Hello and welcome to our pharmacology lecture. In this video, we are going to understand ACE inhibitors, their mechanism of action, and their important adverse effects. By the end of this lecture, you should be able to explain how ACE inhibitors reduce blood pressure and understand why they can cause cough, hyperkalemia, and angioedema. ACE inhibitors are drugs that inhibit angiotensin-converting enzyme, commonly abbreviated as ACE. Examples include captopril, enalapril, lisinopril, and ramipril. They are widely used in the treatment of hypertension and heart failure, and they also have important roles in protecting the kidneys and cardiovascular system in selected patients. To understand ACE inhibitors, we first need to understand the renin-angiotensin-aldosterone system, or RAAS. When renal perfusion falls, the kidneys release renin. Renin acts on angiotensinogen to form angiotensin I. Angiotensin I is then converted by angiotensin-converting enzyme, or ACE, into angiotensin II. Angiotensin II raises blood pressure and blood volume through several actions. It constricts blood vessels, vasoconstriction. It stimulates aldosterone release from the adrenal glands, thereby increasing sodium and water retention. It triggers a DH release, which results in increased water reabsorption. It enhances sympathetic activity, activating alpha receptors on blood vessels and reinforcing vasoconstriction. Finally, with chronic elevation, angiotensin II promotes cardiac and vascular remodeling, characterized by hypertrophy and fibrosis. The important adverse effects of ACE inhibitors include a dry cough, hyperkalemia, hypotension, and angioedema. The cough is related to increased bradykinin. Hyperkalemia occurs because reduced aldosterone decreases renal potassium excretion. Hypotension can occur, particularly in susceptible patients or when the patient is volume depleted. Angioedema is less common but can be potentially serious. One important safety point is pregnancy. ACE inhibitors can cause serious fetal harm and should be avoided during pregnancy. This is an important point that students should remember for both clinical